You might be surprised, but there's a single muscle in our face that determines how young we appear to others. Take a look at this photo. Here are a daughter and her mother. At 26, the daughter has a well-defined facial contour, prominent cheekbones, no wrinkles, and firm skin. Take a look at the mother. You'll notice that her face has changed from a youthful triangle to a square shape. This happens when the lower third of the face becomes bulkier and heavy-sevener. You can see that the facial contour is no longer well-defined. You can notice the appearance of jowls, nasolabial folds, and the skin is no longer firm and smooth. There are a lot more wrinkles, the face looks puffier, and it has started to sag downward. And you might tell me that all of this is just due to aging. You can't stop the process. But what I'll tell you is that there's one muscle, and all of this depends on its spasm. If you work with this muscle and relax it, you can make your face look 10 years younger. And that muscle is the masseter. Here it is. Now, for the next 3 minutes, we're going to do a technique to relax this muscle, and you'll be amazed at the results you get. Let's get started. To do this exercise correctly, your palms need to be placed directly on this muscle. The masseter muscle attaches to the angle of the lower jaw. And here, if you clench your teeth, you'll feel the muscle tense up. Next, find your cheekbone. It's right here, and you place your palm on this muscle. So you're pressing on the lower jaw from both sides, holding it in place, and then you start pulling strictly downward. When you create this downward tension, your mouth will involuntarily open or slightly open, and the muscle will gradually start to stretch as well. It's incorrect if you place your fingers not on the muscle, but on the cheekbones and pull on the cheekbones. That way you're just stretching the skin of your face. It's also incorrect if you pull the jaw forward. If you try to pull it forward, you could dislocate the temporomandibular joint. But besides the muscle we are working on now, there's also the temporal muscle, which works in tandem with the masseter muscle, and you need to work with it differently. I recommend doing this exercise for 3 minutes. Yes, after about 30 seconds, you might feel that it's hard to do the exercise and to keep your elbows up. So you can also rest your elbows on a table and do it right there. What might you feel? You might feel burning, numbness, or warmth. These are good signs. The main thing is to avoid pain. If you feel any sharp pain in the area of the temporomandibular joint, stop doing this exercise. Even after doing it just once, you might notice that your cheekbones are lifted and the lower third of your face looks slimmer. If you do this every day, you'll look 10 years younger. Friends, after doing this technique for 3 minutes, be sure to take an after photo. You'll be amazed at how your face has already changed. Next, open your mouth a few times and try to feel how your jaw moves now. You'll notice that your jaw feels lighter and more flexible. And please be sure to share your results with me in the comments. I'll be really looking forward to it. You can look 5 years younger. In my program, you can tighten your face, reduce puffiness, and get rid of wrinkles. Join now. And make sure to subscribe to my channel, because every week I release new episodes where I talk about how to stay healthy and beautiful. This was Dr. Alice with you, and see you next time.
The muscle that causes the jawline to lose its definition, wrinkles to appear around the ear, and venous rings to form. And most people can't find this muscle or massage it correctly. They simply can't even grasp it. To find it, you need to turn your head slightly to the side and then tilt your head downward. And this cord right here, that's the muscle. So you absolutely need to grab it, and then we start working with it. We begin to stretch it, because it often becomes stiff and rigid, which leads to signs of aging. And make sure to work on both sides. After this, you'll notice your face starting to look younger. I have even more exercises on my channel. Subscribe.
If you really want to take 5 or even 10 years off your appearance, and also to improve the contour of your jawline, you need to work with the mouth diaphragm. Just by doing these 2 techniques, your facial shape will instantly look younger. People are generally lazy by nature and are always looking for a magic pill. And so, in fact, the entire beauty industry, and even medicine as a whole, is set up in such a way that it encourages this. If society, if people, have a demand to get instant results right here and now, whether it's to relieve pain, improve the facial contour, or rejuvenate the face, then the market will offer solutions to meet the demand. You know, right? And that's why many doctors, cosmetologists, and plastic surgeons are also trapped by this, because they play along with it. People want quick results. They want to solve their problem literally in 1 or 2 minutes. And so a vicious cycle of deception is created. Because in fact, all of this is aimed only at eliminating the symptoms, only the visible manifestations. Should we say that this isn't necessary? No, I'm not against cosmetology or plastic surgery. Go ahead, do it if you want. But you just need to understand that these methods don't address the root of the problem. And very few people actually want to think about that. Because in order to solve the problem in a comprehensive and global way, you have to spend much more energy and time and wait for results that might not appear in a minute, but in a week, a month, or even a year. But it's only by taking this approach that you can gain something real, not just an artificial shell. For example, let's talk about the face shape, the contour of the lower jaw. So, if the contour of the lower jaw is well defined, it gives a more youthful appearance. When that contour becomes blurred, it naturally makes you look older. What tools are available? A cosmetologist has a tool, hyaluronic acid, which can accentuate the contours of the lower jaw or enhance the cheekbones so that, by comparison, the lower jaw appears smaller. There's also the option of injecting lipolytics to dissolve the fat that's located here. Well, there are many other methods too: laser cosmetology, botulinum toxin, and even plastic surgery, which can give you a lift, specifically of the chin, to improve the shape of your face. But what are all these methods aimed at? They're only aimed at the surface tissues. Of course, all of this is pretty cool. It does have some effect. But first of all, if we're talking about beauty injections like hyaluronic acid and you're trying to reshape your face with it, just keep in mind that if you get carried away and do this regularly, in 10 years your face will become very puffy. And your skin will get looser and rougher. Because hyaluronic acid attracts moisture. But if we're talking about holistic rejuvenation, if you really want to look 5 or 10 years younger, the real reason isn't just that the contours of your face have started to sag somewhere. The thing is, when other people look at you from the outside, they visually take in your whole body, from your feet all the way up to the top of your head. It starts with your walk, how flexible your body is, your posture, and even your neck, whether you have a long, beautiful neck or if it's tense and hunched over like this. Yes, and on top of that, you can develop a hump and a shortened back of the neck. And then you start to get that saggy turkey neck skin here. You might be able to fix it here, but if you keep this posture, beauty injections won't help you. That's exactly why I encourage you to look at yourself more broadly, as a whole. If we're talking about the face shape, what is it connected to? Certain problems with the spine. For example, when the neck shortens or the spine becomes very rigid. For me, if my head and neck are elongated, or if my neck is compressed, I get excess skin here. The face shape becomes less defined, meaning the jawline loses its contour and folds appear in areas where there's a lot of tension. And if there's a lot of tension in the neck, remember, the lymphatic vessels run through there. This will cause swelling and stagnation. No cosmetic procedures can actually stop this swelling and deformation. They can only cover it up a little on the outside, maybe smooth it out a bit. But these procedures don't address the underlying mechanisms or causes. I've explained to you which direction you need to move in. And in this short video, I can't give you the entire set of exercises, but I'll show you a couple of techniques that will noticeably improve the contour of your lower jaw right before your eyes. To improve the contour of the lower jaw, you need to work with the oral diaphragm. Muscles here make up the oral diaphragm. There are also internal deep chewing muscles and external chewing muscles. The sternocleidomastoid and platysma, the subcutaneous muscle, also have an effect. Now we're going to work on this area. So, for the first technique, we'll be working with the platysma muscle and the sternocleidomastoid muscle. To do this, we grab this muscle, and our task is, after grabbing the muscle, to start lifting the ear upward and to the other side, stretching this area. Why do we need this? By relaxing these muscles, you create a relaxation effect in the area of the jaw angle. That's why you work these muscles by doing tilts. Hold the muscle and bend to the side. There's another option. You can simply smooth it out. Just take the muscle and smooth it. You might even notice that your ear lifts up, your cheekbone rises, and your lower jaw looks lighter and more toned. Do this on both sides, spending about 2 to 3 minutes on each. Fix and stretch the muscles. At the same time, you can also slightly lift your chin up to get a good stretch in the platysma. So, use your hand to hold it in place and make these movements. After this, you might feel a pleasant warmth and relaxation in this area. Next, we'll start working with the mouth diaphragm. And here, right at the angle of the lower jaw, the chewing muscles are attached, and there is a diaphragm there. I suggest placing one finger just below the ear, right under the lower jaw, under the bone, and then another finger further along. So you end up with, as you can see, 2 fingers at the angle of the lower jaw. You place your fingers there. There are a lot of different muscles there. Plus, there's also a gland there, the salivary gland. With massage, specifically vibrational massage, you can help these muscles relax. And this also helps eliminate lymphatic congestion in that area. That's why this simple technique improves the contour of the lower jaw. Just do it regularly. There's no need for any expensive procedures. Just take your fingers, place them, and start pressing inward. And I guarantee that you'll see results. Because when you relax these muscles, the deep muscles, and stimulate lymphatic drainage, you'll notice that the contours of your lower jaw become more defined. That's how simple this technique is. I've just shown you 2 techniques. Simply by doing these 2 techniques, the shape of your face will look younger. Now, I'm waiting for your feedback. Please tell me what you felt while doing these techniques. I show deep techniques on my course, no expensive tools, just your hands and 15 minutes a day, but the result is very deep and effective. So, if you want to look 5 years younger naturally, join the link in description. And if you have any questions left or want to ask me something, write in the comments. Like this video, subscribe, and see you next time. This was Dr. Alice.
This video is a must-watch for anyone who has developed wrinkles, sagging facial contours, jowls, drooping cheeks or eyelids, or whose face overall looks tired. Most importantly, you want to change that. Today, friends, we're going to talk about ptosis and the deformational type of aging. I'm going to tell you about some non-obvious things that cause the face to sag and look tired. I'll also show you exercises that can help eliminate this problem. So make sure to watch until the end. Before we begin, please subscribe to my channel and give this video a like, because it helps my videos get promoted on YouTube so that as many people as possible can see them. Friends, ptosis is a process in which the tissues lose their elasticity and the face gradually sags downward. And this is not only related to age, aging, the environment, or gravity, because gravity affects everyone equally. At 50 or 60 years old, 2 people can look completely different. The first cause of ptosis is excess weight. That is, when the fat tissue in the face increases, it stretches the skin under the influence of gravity. And be careful, if you decide to lose weight quickly, it can make the situation worse because the skin and connective tissue don't have time to adapt to the rapid weight loss. And these deformations will remain. Yes, you'll have less subcutaneous fat, but the sagging skin will stay. That's why, if you're going to lose weight, it needs to be a slow process. If you look at people from a young age to old age, what can you observe? You can see that with age, the spine starts to shorten, literally to shrink. Imagine a spring that is being compressed, and the more it compresses, the more tension builds up in the body, and the shorter the neck becomes. What I've noticed is that everyone with a short neck has a sagging facial contour. Just observe it. Pay attention to your posture. If your neck shortens significantly, you'll start to see sagging. Friends, I'm curious. Do you actually believe that at 50 or 60 years old, it's possible to completely eliminate a sagging facial contour or not? Please write your thoughts in the comments. The next unexpected cause of ptosis is tension in the skull. You usually hear about muscle tension, but few people mention that tension and tightness can also occur in ligaments, blood vessels, organs, and even the bones of the skull. As we age, nerve conductivity decreases, and nerve conductivity is responsible for metabolism and tissue nourishment. If there is compression, it further reduces nerve conductivity, which leads to fluid retention in the face. The face will become more swollen, and the skin will appear looser. And the next unexpected cause, which I think will surprise many,
is the tension transmitted through ligaments and muscles into the fascial system from the internal organs. In other words, all these organs are interconnected. If there is tension in the intestines, it can be transmitted from the intestines to the liver, the stomach, the heart, the thyroid gland, the organs of the neck, and further to the face. That's why the tensions coming from the internal organs play a key role in the development of facial deformation. Moreover, I'll show you a simple example. Look, let's say there's a blockage somewhere in the intestines, in the abdomen. You touch the abdomen, it's bloated, tense, there's some tenderness, right? This knot of tension, this blockage, leads to tissue pulling, and the body literally starts twisting in this direction. You see, the shoulders start to curl in, the chest begins to collapse, the belly may, on the contrary, stick out, the neck starts to shorten, and this leads to the appearance of a double chin. But in reality, the cause is over there. By the age of 50 or 60, when a person has issues with the gallbladder, problems with the intestines, and so on and so forth, all of this leads to severe tension in our body, which deforms the face. And can you imagine, no one talks about this and no one thinks about the fact that at 50 or 60 years old, the face looks aged not just by chance, but because it's a specific biomechanics of aging that occurs at the level of the face and the entire body. And the next important cause of facial deformation and the appearance of jowls is swelling. Everyone who suffers from swelling experiences the deformation process accelerating, I think, even 10 times faster. Why does this happen? Because when fluid accumulates in the subcutaneous fat tissue, it increases the volume of the tissues. And since the skin is thin, it simply starts to stretch. For example, even if you've done lymphatic drainage or restored your body's water balance, the skin still remains stretched and deformed. It's very important to make sure there is no swelling on the face. Do lymphatic drainage exercises and lymphatic drainage gymnastics daily. It's possible that exercises alone won't completely solve the problem, but in most cases I've observed it's even possible to fully restore the facial contour. And as I promised, I'll now show you an exercise that will help release these tensions and lift the facial outline. Take hold of the corners of your mouth with your hands. Many muscles attach in these areas, which are connected to the neck and even the chest. You grasp the corners of your mouth and then begin to alternately pull them upward. At the same time, you can even slightly tilt your head. And I'd like you to close your eyes. You may notice that on one side, the corner of the mouth lifts easily, while on the other side, it's harder to raise. Why is that? It's directly related to tension. Try to feel where that tension is coming from. Most often, you'll notice that this tension comes from somewhere in the body. Place your hand on that area, say, for example, on your chest, and on the corner of your mouth, and stretch as much as possible. You can hold this stretched position for a while until the tissues begin to relax, or you can slowly make circular stretching movements. And we do this for about 2 minutes, just stretching and making circular movements while observing what's happening. Don't forget to breathe. Inhale, exhale. And after that, you can smile and see how the smile feels. You can then do a retest and observe how the tissues move on one side and on the other. And you'll feel that on the side where you did the stretching, the corner of the mouth lifts more easily. After that, do the same on the other side for 2 minutes as well. Grab the corner of the mouth, place your hand on the chest, on the sternum, create some tension, and make circular movements. At first, you might feel some tightness or a kind of heaviness appearing. If you keep your focus and your hands on that tightness, making those circular movements, you'll feel that the tension gradually relaxes, and eventually the tightness might even disappear completely. And after that, the corners of your mouth will start to lift. And along with them, all these surrounding structures will begin to relax and lift as well. Next, you can simply do one of the easy and effective exercises. This kind of nasal massage like this. Circular movements for the nasal massage. What does this technique do? When you move your mouth, the movement itself creates a massage effect. These muscles begin to relax. First and foremost, the muscles that relax are the ones responsible for facial ptosis and tension.
And next, after that, I recommend regularly doing lymphatic drainage. Your movements should go from the chin toward the ears. I recommend doing this regularly. You can even do it like this. So, for example, if you're in front of a reflective surface like a mirror, you can carefully and gently use your hands to make smooth and even motions or movements in one direction and then slowly in the other. This is the bare minimum to help relax this area and eliminate stagnation. And remember, a sagging face and deformation are not a sentence, and it doesn't mean you need to run to a plastic surgeon right away. Subscribe to my channel. This was Dr. Alice with you. See you next time. We age rapidly when these three muscles stop functioning properly. By doing the exercise for just 1 minute a day, you'll regain youth and a beautiful posture. This is Dr. Alice, and today we will do 3 simple techniques for the 3 muscles for eternal youth and a beautiful posture. The first muscle is the sternocleidomastoid muscle. Here it is. On one side it attaches to the sternum and clavicle, and on the other side it attaches behind the ear to the mastoid process of the temporal bone. Here it is. When this muscle tenses up, it shortens the neck. If it shortens unevenly on both sides, it can lead to asymmetry. So, facial asymmetry, which can occur, and the neck can become tilted. Under this muscle, inside you can see the vessels shown here in blue. Here they are, the vessels, red and blue, are coming. When this muscle tenses up, it compresses these vessels. And as a result, swelling on the face can occur because the lymphatic vessels run under this muscle. And it can also lead to headaches, a heaviness in the head, like a hangover. As a result of the tension in this muscle, there is oxygen deprivation in the brain. And of course, this affects and causes age-related changes because when the neck shortens, when there is chronic swelling in the face. All of this contributes to age-related changes appearing more quickly. The next muscle, this is the trapezius muscle. It also plays a key role. Look, this muscle attaches to the shoulder blade, it attaches to the thoracic part of the spine, and it also attaches to the neck and even goes up to the occiput. If we remove this muscle, here it is, it attaches to the occiput. When this muscle tenses up, the shoulder blades start to rise. The back of the head starts to drop down and the head juts forward. This leads to a shortened neck and raised shoulders. A short neck leads to the appearance of folds on the neck and venous rings appear. Next, this manifests as the appearance of a double chin. The contours of the lower jaw are spreading, and besides all of this tension here can cause headaches, tension. It can also cause disruption of blood flow in the head and chronic swelling. Short extensors, here they are, the short extensors. In this area, they are located inside between the vertebrae, and they, Mate, have a tendency to tense up. When the head juts forward, when it becomes overloaded, these muscles spasm so much that the blood vessels passing through here can lead to vertebrobascular insufficiency, where blood flow in the head is disrupted, causing stagnation. And all of this leads not only to the fact that a person starts to think poorly, but they also get dark circles under their eyes. Bags under the eyes can appear, the face becomes puffy, and the reason for all of this is that the neck is spasmed and shortened. Friends, if you want to maintain the youthfulness of your face, you definitely need to work on your neck and these muscles. Because the foundation, this is the whole face. The entire skull is actually located on the neck. The neck controls the skull, and by working with these 3 muscles, you guarantee that your face will be preserved for many years. Well, now we will finally move on to the exercises, and I will show you how to do them so that you can maintain your appearance for many years by working with these muscles. In the first exercise, we will work with the sternocleidomastoid muscle. For this, you need to pinch this muscle like this to hold it in place. Here it is, you see, when you nod. See, it's being contoured. Find it, find that belly and hold it. With your other hand, just place it on your ear, right behind the ear, where it attaches, and start making stretching movements like this. You just take it slowly and start stretching it. You can take a breath. Exhale. Inhale. Exhale. And like this, you grab that belly and stretch it, meaning you just need to slowly and carefully stretch it out without rushing on one side. And then, on the other side,
grab that belly with your hand further back, behind the ear, and start stretching it out like this. You can even grab it like this. And like this, you move your head from one side to the other, and the muscle stretches, and you'll feel more lightness in your head. You'll notice that by doing this on both sides, your face will become more symmetrical and harmonious. Like this, we work with the sternocleidomastoid muscle, performing this technique as well as the following others. You can work on your neck really well, but there are also many other techniques for working with internal organs, the spine, the skull, and the face. In the next exercise, we will work with the trapezius muscle. You need to constantly stretch this muscle so that your shoulders don't rise up. What are you doing? So you take one hand, and if you're working on the left side, you bring it behind your back like this. Lower the shoulder blade down and press your hand down. You should already feel the tension building up. Now you should feel the tension. Even if you stretch to the other side, that muscle is already being stretched. Next, you can simply use your hand as a weight and place it on the back of your head. And now you're feeling the stretch. In this position, you can relax, close your eyes, and breathe. And you'll already feel the relaxation. You can enhance the effect how you start push the back of your head in the opposite direction. So after you've stretched the muscle, now you tense it up. You've stretched it and are applying pressure to your own arm. Slide, take a breath in, and exhale and relax. So what are you doing? So you lowered your shoulder, head, and occiput, turned to the opposite side, and tilted your head a little. You should feel some tension, so the muscle is stretched at the occiput. You place your hand as a weight, and then your occiput presses against your hand, creating pressure in your hand. At this moment, the muscles tense up, and your task is just to hold it in tension. Inhale for 5 to 7 seconds, and then exhale sharply. Place your hand, take a breath, and tense up. Exhale. And after that, you'll feel that it will start to stretch even better. And you do this several times on each side. Then you lower the other hand. On the occiput, you release your hand and stretch the muscle. And again, press the occiput into your hand. 5 seconds, inhale. And exhale. And relax. This is one of my favorite techniques, which always gives great results. I do it all the time because as soon as I notice swelling in my face, I work on it. These muscles and swelling will go away. And please write in the comments how you found the technique, what effect you felt. And the third exercise is for the short extensors. Here, the short extensors are highlighted in blue. And they often go into spasms, which is exactly why the neck cracks. And an unpleasant effect arises. And of course, they disrupt the brain's nutrition. So, it's a simple technique. You place your hand on the back of your head and you put your hand right in the projection. Here, there are these little bumps, the spinous processes, and you stand to the side, right at the position of these muscles. And you start making these kinds of movements. So you do extensions and flexions and stretch these muscles. So, right here, at the top of the occiput. So one hand is on the back of your head and you do it like this. You do it on one side and then on the other side. Then you move your hand like this. These three muscles are the key to your youth. By strengthening them, you will not only improve your posture, but also achieve a powerful rejuvenating effect. Take care of your health and youth, so make sure to subscribe to my channel because every week I release new videos where I show exercises. This was Dr. Alice, and see you next time. The 3 magic points that can eliminate many different wrinkles. So working with these points helps the face to smooth out. You'll feel the tension in your eyes decrease, and the tension in your forehead will lessen. Wrinkles and folds on the face are probably the most common issue that makes a person look older because as we age, we get more wrinkles. They become deeper. Many girls go the route of cosmetology. They start getting injections in their face, and it really smooths out. They get quick results. But what happens if you take that path in the long run? Well, first of all, it's expensive. Secondly, you'll need to constantly get something injected every 6 months to a year. Thirdly, there are still negative consequences in the tissues. Because when you inject the skin,
Women who constantly inject themselves will still become deformed with age. Their face becomes like a ball, the skin becomes very rough and loose. Why does this happen? Because when you inject the face, it doesn't work. The facial muscles and lymphatic vessels do not work, swelling still occurs, and swelling provokes deformation. But there is another eco-friendly way, which is working with your face and body to release various tightness, because it's those tightness, those areas of tension in the tissues that cause fluid to accumulate, and the muscles start to spasm. And when the facial muscles are spasmed for a long time, it leads to wrinkles. And I can show you 3 magic points that can eliminate many different wrinkles. They are connected to the areas where the most tension accumulates in the face, in the facial skull. And these are the areas where the lymphatic vessels also run. By stimulating these points, you improve lymphatic drainage from your face and relax the facial and chewing muscles. And this will have a rejuvenating effect on the face because the skin and subcutaneous tissue start to smooth out. The first points we will work with are part of the bridge of the nose and the inner wall of the eye socket. This area affects the wrinkles on the forehead, the wrinkles around the eyes, and the bags under the eyes. Just pay careful attention to how many facial bones connect in this area. That's why there's constant tension here, and the face literally wrinkles towards this area. So, by working with these points, the face starts to smooth out. The next points are right under the wings of the nose. In this area, there are muscles such as the muscle that raises the blood from the nose, the muscle that raises the upper lip. These muscles are often tense, and that provokes the appearance of nasolabial folds. The third point is the area of the chewing muscles. The angle of the lower jaw work with these points. You relax your chewing muscles, which models facial proportions. The fact is that when the chewing muscles contract with age, they spasm and the face becomes deformed. When you relax these muscles in these areas, it also improves lymphatic drainage. And accordingly, the lymph won't stagnate in the face. Now I'll show you how to work with these points on myself. The first point, area nose bridge. You use your index and middle fingers. You place your index fingers on the inner wall of the eye socket. And your middle fingers go on the bridge of the nose. So you place your fingers like this. You tilt your head, relax, and start to feel the tension in the bones, and you begin to make a light vibration. By making a light vibration, you relax the bones of the facial skull to which the muscles are attached. And this way, you can also take a deep breath. Exhale, and you'll feel that when you make this vibration, you might notice that your forehead is tense, your eyes are tense, and gradually, as you vibrate these points, you'll feel the tension in your eyes decreasing. The tension in the forehead decreases. At the same time, we observe the tissues. Take a deep breath, and on the exhale, we release the tension. So, in general, I recommend working on this area. There's just a lot of tension building up here. The next points are right under the wings of the nose. These points, right under the wings of the nose. If they are painful and uncomfortable, it means that there is a lot of tension there. This is where nasolabial folds appear. So I recommend placing your fingers right under the wings of the nose and starting to massage those areas. You can also do a light vibration. You can place your fingers like this and make vibrations. You can even do the vibration. While focusing inside the nose, there's even the daily seam between the 2 upper jaws, relaxing all the upper jaws, and just do it. Relaxed for about a minute or 2. These points relax not only the facial bones, but since the muscles are attached to the bones, they also automatically relax. Conclusion, if you massage these points well for a couple of minutes, you will feel that this zone, you will even feel that they are less light, and relaxation will be even more difficult for you to lift the wings of the nose up. This means that relaxation has occurred, friends, before we begin massaging the third point. And now we move on to the third exercise. Our task will be to find the painful points in the area of the angles of the lower jaw, and you start to massage them. So, you massage, and you might feel where the muscle attaches and there's some tenderness there. Or you can simply do this to gently relax your lower jaw and comfortably make some light vibrations in a soothing manner. And you'll feel your muscles starting to relax. So you place your finger here and you feel some tenderness. When you start to massage or do light vibrations, you relax your lower jaw, and after a while the pain will begin to go away. And all of this, first of all, shapes your face, rejuvenating it. This provides a lifting effect. The cheekbones lift up and the lower part of the face becomes lighter, narrowed, and main thing is swelling goes away, because all the lymph from the face passes through this area. By relaxing the area of the desired muscles, you improve lymphatic drainage. So, by working with these magical points, you can really make a difference. 97% of all wrinkles. And I showed you the tools to work with this. I recommend doing this set every day, as long as you feel tension there. If you feel any discomfort, please use that as the main criterion to know that you're doing it right. You need to learn to feel the tissues, to sense where there's tension and density. So, use your attention, do everything in a light meditative state, not from your head but from your feelings. By observing this density of tension in the tissues, your task is to make the tissues become more relaxed and lighter. When you work with bones, they should also become more airy, lighter, and you'll see that after a while, when you massage these points, you won't feel anything at all. This is a sign that you've already worked on these areas enough. On my channel, I will share with you a variety of recommendations and techniques. Like and subscribe. This was Dr. Alice. Bye-bye.
Most women who see wrinkles on their forehead immediately rush to get Botox injections. But this is a potentially dangerous procedure. I found the results of large studies and was surprised because Botox causes headaches and migraines in 24% of cases, which can be bothersome for a long time. Additionally, allergic reactions often occur in 18% of cases. Can you imagine? And today I will show you a simple technique and also share secrets on how to work with your face so that these wrinkles truly disappear just from your touch without any Botox. In fact, the cause of forehead wrinkles is located in a completely different place, not here. If we look at the anatomy, what do you see? Here is the forehead, and beneath it is a muscle. This is the large fronto-occipital muscle. And look at how it runs. It runs from the forehead, then through the entire aponeurosis of the head, and then goes back to the occiput. Do you see where it attaches? So, tension in the occipital area leads to folds appearing here. Can you imagine? And that's not all. If you look, these occipital muscles further transition into the posterior muscle of the fascial chain, and then it extends to the shoulders, transitions to the back, and reaches the shape pelvis. And even tension in the coccyx and lower back area can lead to creases on the forehead. Ideally, you need to work with this entire area. That is, if there are back problems, it will lead to wrinkles on the forehead. Also, if the neck is tense, everything here is shortened, it will also lead to wrinkles on the forehead. Just even tense your occiput, tense your neck, and you will feel that your forehead starts to tense up. Just do this, and you will feel that everything here starts to tighten. The second reason is that behind this muscle is the skull, the bones of the skull. And the skull bones themselves, why, can also be rigid and tense, because many structures are attached inside, and this can also transmit and form creases here. Therefore, it is necessary to work at least with this fronto-occipital muscle as well as with the frontal bone itself. And then, indeed, the forehead will smooth out. And of course, there are many such non-obvious connections in our body. I have been studying them for many years. Many doctors, cosmetologists, and other specialists simply do not know this. Therefore, they have their tools, a cream or a syringe with Botox, and that's what they offer. But when you understand the cause and effect relationship, you can help yourself in an eco-friendly way without harming your health. And, well, you can start doing this right now because I have put together a free course of effective techniques for you. You just need to follow the link and start doing them. Now I'm going to show you the exercises. We will be working with the fronto-occipital muscle. Watch. First, you can simply do a massage and it will have an effect. For this, you need to relax the occipital area, right there, where the occipital protuberances are. You start massaging and thoroughly kneading this area. You can make movements like this. This also affects the forehead. And only at the end do you work with this area. You can also relax this muscle like this, simply kneading it with your fingers like a rake. And this smooths out the muscle. The muscle begins to relax. So
With these rakes, you can do it here, along its path, and here. This is the simplest option that I am showing. What else can be done next? If you look, the fibers of this muscle go towards the crown of the head. I recommend grabbing it from both sides and starting to pull it towards the crown of the head. When you pull and hold it here, under tension, it will begin to relax completely. What do? So, you place one hand on the back of the head, the other hand on the forehead, and you start just shifting it, right? You can tense the muscle, that is, make a surprised face, raise your eyebrows. Feel how it works. You will feel how the back of the head starts to tense and how the forehead begins to tense. There, feel this muscle. What are you doing? So you start to pull it towards the crown of the head in reverse. So you are kind of lifting both hands upwards, right? You start to pull. Pull towards the crown and then stretch upwards with the crown as well. Stretch as much as possible and hold. Hold like this for 30 seconds. Yes, your arms might get tired, but bear with it a little. Take another deep breath. Relaxation will come stronger and faster. And after relaxation sets in, you start in the opposite direction. Lower your eyebrows down. Like this. Don't worry, your eyebrows won't actually drop, but they will relax. And repeat like this. That is, you pull it towards the crown of your head. After holding for 30 seconds, then you start to release the back of the head down and stretch the eyebrows, the entire forehead down as well. In this way, also of course, I recommend relaxing the neck, because the better you relax the neck, especially the back of the neck, stretching it, this also relaxes the forehead. And that's not all. What else can be done? You can work with the bone itself. What can you do? I recommend a very simple technique, which is tapping. That is, you just direct your attention to your forehead, focus your attention and tap, and you will feel that when you tap, some areas will be denser. Often, this is the area of the bridge of the nose. And find where there is density. Just start tapping and breathe. Inhale. Exhale. Do it with both hands. And you are precisely removing the tension that is in the bones. This is such a simple technique that anyone can do. There are, of course, more advanced techniques for working with the skull, which I teach at the Academy. But they require high perception and the development of hand sensitivity. You can work with all the bones of the skull, with all the structures in the body, but with this kind of technique, you can feel it yourself, close your eyes and immerse yourself in the sensations. Where there is no tension, it feels easy. And where there is tension, stiffness appears under your fingers, and you start observing this area, taking a breath in and out. And this area begins to melt, and the forehead starts to smooth out. After this, you can do simple things like this for the skin, rubbings, or these kinds of kneadings. All of this works on the skin, smoothing it out. But understand, it's often said, oh, I do massages and there's no effect, or some exercises. The thing is, people mainly focus only on the skin. If you only rub the skin, the effect lasts for 5 minutes. Because if the muscle is in spasm or there is tension in the bones, then everything will, of course, return. But if you work here with the muscles, the bone, and essentially the whole body, then of course, it will have an amazing effect. How do you know if you're doing the techniques correctly? There is one criterion. Before the techniques, the eyebrows easily lift upwards. When you perform the techniques, relax the forehead and the muscle, it becomes harder to lift the eyebrows upwards because the muscle is relaxed. And the second criterion, of course, is that the wrinkles disappear, meaning the wrinkles smooth out. If all the techniques are completed, please write how you feel in the comments below. Dr. Alice was with you. Here on the channel, I talk about how to be healthy, how to be beautiful, and how to help yourself and your loved ones with natural methods. So be sure to like and subscribe. See you next time. To look younger, it's not necessary to immediately run to a plastic surgeon and have surgery, or to a cosmetologist to inject fillers or Botox into your face. There are other methods. Today, I will show you simple exercises that will help you instantly look 5 years younger after performing them. And if you do them regularly, you can look up to 10 years younger.
There are important muscles on the face that lead to premature aging. These are the chewing muscles, specifically the masseter and temporal muscles. Here they are on the screen, you can see how they work. The fact is, they are constantly involved in the act of chewing and often spasm due to stress. When these muscles contract, the face becomes, literally, the lower part becomes heavier. That is, if you feel it, the youthful angle here starts to disappear. Here, puffiness and swelling appear, a kind of heaviness. That is, lymphatic drainage occurs through this area. If this muscle here is tense, it creates swelling on the face. And the temples too, when this muscle is tense, it seems like our eyes, they start to kind of droop down. And the face literally starts to change from a more oval shape to a more round one. I recommend you first, place your fingers under the cheekbones. Right from the bone, and place your fingers under the cheekbones. And check if your cheekbones are at the same level or not. Because when you perform the technique, you will feel and see that the cheekbones become more expressive and symmetrical. Place your hands on the lower part and test your face. How easily it responds to lifting. If there is heaviness here, then we will work with it and then see what changes. First, you find this muscle and start to rub it with your fingers, literally like this. Look, rub it. That is, you simply take the fibers and start kneading it. It's normal, that is. If you find a painful spot, start kneading it. No need to force it, that is, slowly relax and breathe. Exhale. That is, spend a few minutes of your time on this. Gradually, you will simply feel that this muscle becomes softer, it relaxes. Then we move lower. Find a painful spot and start kneading it. And breathe. Inhale, exhale. Then we go down. And right here, where it attaches to the bump, you also knead. You can do it with one finger or with your fingers low. Like that. Do it on one side and accordingly on the other side. Grab it, hold it, and rub it. You may feel that your cheekbones are freeing up, the lower jaw, it will become lighter. It's as if it descends downward. And after you've relaxed it, you can spend more time on it than I am right now. Next, we need to stretch it. Look, it's very important not to pull the skin. You need to grab the lower jaw and simply pull it downward. Then, if you pull the lower jaw, your skin, if you look right here, remains mobile. And there, it's the muscle inside that stretches. That's why you grab the lower jaw, like this. With the base of your palm, grab the angle of the lower jaw, like this. And the mouth, we completely relax. And it's like we pull down with our hands, while reaching up with the crown of the head. And as a result, the muscle here starts to stretch. And this way the face will elongate, you stretch it out. And so for 2 to 3 minutes, you directly stretch the lower jaw and then we move on to the temporal muscle. Now look at the temporal muscle. If you place your hands here and clench your teeth, you feel it. Here it attaches, and what you need to do is first of all massage it. You can simply take it like this and stretch it. Just take it and stretch it out. And while doing this, open your mouth. Just perform this technique. You can do it starting from the cheekbone. Place your fingers and start like this. Completely relaxing the jaw and stretch it out. Temples. That is, you need this entire area to completely relax. And then you can even smooth it out. Take it like this and just smooth out each area. Smooth it out on one side and then on the other side. That is, you will feel that it will be easier for you to open your mouth, and it seems like your gaze becomes more open, as if your face becomes more elongated and wider. This provides a good facelift. And these exercises that I am showing are the basics. But, of course, for a better effect, you also need to work with the skull bones and other muscles. So click the link below and take the first step towards rejuvenation with my free course. Be sure to subscribe to the channel because every week I post new videos about rejuvenation and health improvement. Give it a like. This was Dr. Alice with you, and see you next time.